If you want to do business with HCA Health System, you are in the right place. If you are a healthcare consultant, or maybe you have a healthcare sales team, and it would be your complete dream to work with HCA Health System, if that's the case, you're in the right place. Welcome to our corporate acquisition series, where I'm going to be helping you take a deep dive into the 10K and annual reports of various healthcare systems. Now, why is this so important? Because your 10K reports are so revealing when it comes to healthcare challenges and needs of organizations. If you're meeting me for the very first time, my name is Elle, former nursing leader, now healthcare business consultant, and I help healthcare leaders just like you master corporate sales and launch profitable consulting firms. Today, we're going to be highlighting HCA Health System, one of the largest healthcare systems in the US. Now, a huge aspect of your sales cycle, your corporate sales cycle, might I add, is that you really understand the internal pains and challenges of organizations before you pitch your consulting solutions. So today we're going to take a deep dive into HCA, so grab your notes, let's go. One of the most important things you can do as you are initiating lead generation is really understand what the organizations offer that you are designed to partner with as a consultant or healthcare agency. So all this information I'm sharing with you has been pulled from the 10K report of HCA Health System, and it gives you a 2023 overview. Currently, we are in the year 2024. So typically when you pull your annual reports, they'll be from the previous year. So as we stand with HCA Health System, they have 182 hospitals, all of which include psychiatric hospitals, rehabilitation hospitals, as well as acute care. They have 125 freestanding surgical centers, 21 endoscopy centers, 156 urgent cares, 15 freestanding emergency rooms, 106 diagnostic imaging centers, 13 radiation therapy centers, and 8 cancer centers. Understanding all of the various facilities within the health system is going to be important, because if you know as a healthcare thought leader, you only focus on freestanding emergency centers, knowing that the HCA system has 15 freestanding emergency centers, if that's your zone of genius, this is a potential client that can be on your radar. So you may not be able to support them with their psychiatric hospitals, but you can support them with being very knowledgeable and in the know of what to have in place and how to conquer any challenges that come up from a freestanding ED standpoint. So now that you have an overview of all of the facilities within the HCA Health System, let's talk numbers. All this information can be pulled from their 10K report. We're going to jump over to that shortly. But an important aspect of preparing for lead generation is working with organizations who can afford to bring you in as a healthcare expert. Now, when you get to expert status, you are not cheap. You're very expensive. So understanding how much organizations are bringing in, and if they're actually profitable or they've had losses, will be extremely important to know. Do you want to spend time pitching to this organization and they can't afford to bring you on as an external consultant? So in regards to the numbers with HCA, in 2023, they brought in $21.3 billion in revenue. Now let's talk profit and loss. Their net income was $5.6 billion, meaning that HCA Health System was very profitable in 2023. So now that we have some of the basics covered with our research into HCA Health System, let's dive into their 10K report to really determine what were they challenged with in 2023. I just pulled up the 2023 HCA annual report. This document is quite extensive. It's about 127 pages long. So we're not going to go over the entire document. It's extremely detailed, but I will provide the link below for you to have access to that 10K report. But again, this is going to be extremely important as you're doing your background research on organizations you desire to do business with, to really understand what they need, revenue losses, revenue in. You can also even see how much they are paying their top executive leaders. It's extremely detailed. So even as you can see here, there's a section on page 33 that goes over risk factors. So if you are unsure specifically what HCA is paying with, they tell you directly in their 10K report. So you don't have to assume what they need. They tell you these are our top priorities. These are what we are really concerned about. So just going through this document here is a true game changer when it comes to, are you spinning your wheels trying to pitch a solution that they really don't have as a priority? So here, just a general overview. We kind of went over in detail the various facilities within the health system. So we talked about how many hospitals they have, how many surgery centers they have, how many endoscopy centers. So again, an overview of that information. They go into their business strategy. So if you want to ensure that you are pitching, but your pitch is in alignment with their strategy, then this is all the information that you need. So it says here, as far as their business strategy, they want to achieve some of these objectives: grow their presence in existing markets, achieve industry-leading performance in clinical, operational, and satisfaction measures, recruit and retain physicians and other healthcare professionals to meet the need for high-quality healthcare services. So this information alone, it is speaking to what they need. It speaks to what they need, what they desire. Continue to utilize economics of scale to grow the company and pursue a disciplined development strategy. What really stands out is recruiting and retaining physicians, because if I were a healthcare consultant and I specialized in staffing, in recruitment, that would be a great segue into working with them, or really building up their physicians and other top talent. So leadership and development comes to mind, employee engagement comes to mind. Those are all various specialties that would be in alignment with some of their goals and their objectives. Again, this goes over some background demographics. And here we go. Page 33 talked about some of their risks, but here's also a quick summary of the risks that they're most concerned about. So as we scroll down, they start to speak to their risks to indebtedness, risks related to human capital. This is going to be huge for those of you who are very much interested in employee retention metrics, culture change metrics, leadership and development. They want to retain top talent. They're telling you exactly what they need. Risks related to technology, data privacy, and cybersecurity. Risks related to public health crisis. So making sure they are proactive when it comes to any kind of infectious diseases, opposed to being reactive, as like many organizations who dealt with COVID-19, right? So now organizations are like, let's take a proactive approach. So even if you are in the infectious disease space and have an infectious disease consultancy, this would be something that you may want to say. The proof is in the annual report. This says risk related to governmental regulation. So regulations is always a big deal because the regulation marketplace is forever changing. So if you can help HCA really stay on top of practicing and operating within regulatory guidelines as things change, and partnering with their pre-existing regulatory internal staff, that could be a segue in regards to you supporting them. Risk related to operation, strategy, and demand. Again, I'm not going to read through all of these, but they're telling you specifically what they desire, what they need. Here are the things that we are worried about. Why is this so important? Because as you are pitching and building relationships and building out your marketing campaigns, you have proof of this is what they said they needed. So you're not assuming what they need. You're looking exactly at their 10K report and they're telling you what they need. If you move down a little further, it goes over sources of revenue. So if you want to know exactly how much they brought in from Medicare, managed Medicare, all those things, Medicaid, it gives you a breakdown of how they're being reimbursed. So if you want to take a deep dive into that. So again, I really just wanted to share this with you. We're not going to go through the entire 10K report. It is 127 pages, but this gives you a complete breakdown of all of the needs, what they've been through, what they've tried. It gives you a breakdown of the data, their numbers. So everything you need is right here as you're starting your lead generation journey. If you desire to do business with HCA, you want to make sure you're having intelligent conversations when you are initiating your marketing campaigns, and this allows you to do just that. So as you can see, according to the 10K report of HCA Health System, they also have challenges that they deal with on a daily basis that their internal team members can't always provide solutions for, which means there is still room for you as an external consultant. So what are their top 5 challenges? Regulatory risks, labor shortages, competition in the healthcare sector, cybersecurity, and operational challenges related to inflation and supply chain issues. My hope is that you found this information extremely helpful, especially if you desire to do business with HCA Health System. Do me a favor, let me know your top takeaway in the comments. I'll see you next time. Take care.